you know why you dey take them and they help your body go ahead. But my own opinion is that um I pray say all these things, ginger, garlic, and the rest. If you go take them for empty stomach, if it cause you problem. But if they give any problem, now your life you can continue. But my own opinion, I prefer people eat their fruits rather than blending it. Sure you get. Yes. Okay, we have a comment here. It says, I watched your video on men checking their testes and found out that the left testis is bigger than the other one, but I'm not feeling any pain. Is it normal? Okay. Let me answer. I don't know if Dr. Israel will have anything to add. I made one video. Get one video why I do about men checking their testes. You get many reasons why. Some men know they check. One feel big. Dr. Israel, it's your mic. So it gets some people, one test is feel big past the other one, if they normal for them. Some other people, the two go dey normal. Suddenly, one go dey bigger than the other, and they no go know. Now only when they check. And then when we can't check, if we can't talk, say, okay, there's something abnormal in this place, make we find out. Now, if the size is significant, meaning say the one way big past the other one, it big well past the other one, then also speak with your doctor, make them check and make them see you. Do you understand? Yeah. Okay. And then for parents too, we get boys. You get male child. You check your pikin. You can't say maybe now one test is day, no be 2 day. Please carry the pikin, make you go see doctor, make doctor check him. Dr. Israel, I don't know whether you get anything to add.
No, I not really get. I think you said it. So most of the time, one test is somehow the big past the other one. It just is. If you look women body, sometimes if you look their boobs, you see say like say one the big past one. So it's just almost normal. But the big past one, not the 2 day very obvious. Not the 2 day very obvious. So as Dr. Fred talk, yeah, it's good to go. You're good to go.
Okay. If you get questions tonight, ask us. Because if we dey talk another topic, people go talk say they won't ask us something, and we know they take up. Now make today we won't answer your questions. So if you get questions, I beg ask your questions today. Because the next Sunday, when we dey teach on a topic, we might not be able to take your questions. Okay. Oh yeah. Oh. Okay. Oh. Let's see. Let me see. I hope I'm not missing anybody's question. Oh. Okay. Okay. Ladies and gentlemen, let me see if I have a question here. What are the foods that have lower cholesterol? What are the foods that have low cholesterol? So you want to respond?
Okay. Cholesterol is one of the fats. Let's say one of the fats. And then when we mention one of the lipids, when would they try to mention the total lipid where they person body? So cholesterol is one of it. So anything where not get fat is low on cholesterol. So when you see food where not get fat, you know that is low on cholesterol. Like your fruits, your vegetables, they are all low on cholesterol. Your fruits and your drinking of water, they are all low on cholesterol. So just know say anything with not get fat, they low on cholesterol.
Thank you. Just know that cholesterol is not bad. Cholesterol is important for your body. Just that some people they carry excessive amount to their system. Okay, we have a question here. Why am I finding it difficult to get pregnant with staphylococcus infection? Dr. Israel, I beg, respond to this.
I don't know where you foresee staphylococcus infection. So staphylococcus not get anything to do with your pregnancy. In fact, I think I would say that. So I don't. You need to go and do a good test, you need to see a gynecologist. When you see a when I mean gynecologist, I mean gynecologist, not be kwekwe one. See a gynecologist. Now I go actually tell you why you they find it difficult to become pregnant. So leave staphylococcus out of you not being pregnant. So if they can't find us, okay, maybe infection join, they go tell you the kind of infection. And because one thing we suppose know is that this staphylococcus, when they always mention, when they mention staphylococcus, if it be say when you want to do the test, if you not collect the sample very well, and they go culture staphylococcus, because staphylococcus they have most every part of the uh, of our body. So let's leave staphylococcus. Why you never get pregnant, you need to see a gynecologist. And when you see a gynecologist, it will guide you. It will guide you on how you get pregnant. So even before you see the gynecologist, you need to first of all know your cycle. When you they see your menses and when they come back, how many days they be from one cycle to another. Know when you they see your ovulation and how often you and your partner they meet. So all those ones they're very important, because if you are not meeting regularly, and we they say regular meeting 3 to 4 times in a week, now we they call regular meeting times medically. So if you are not meeting up to 3 to 4 times in a week, and even when you they meet that 3 to 4 times in a week, you never they meet at the right time, you may not get pregnant. So you need to know all those things first, and try to check and track your ovulation, so that when you meet your partner during that period, you may likely become pregnant. And also infertility, not be only the woman wahala, the man is still part of everything, because not be you go give yourself belle, you dey get. And so your husband still need to do his own test, and their own are just one test that they do. He need to still check his own test. So when he check himself and you check yourself, when are they good, then we cannot other people other things cannot follow from there. But who go do all these things when they talk for you? Now gynecologist. That's why I say you go see a gynecologist. Thank you.
Thank you, Dr. Israel, and love it. And if I may add, gynecologist no go tell you say na staphylococcus na make you no get belle. I believe maybe you dey listen to some people for road on the internet. Please, go hospital and try go with your partner. Every day, e get side effects. No, if she want the knack and her body can take it every day, there is no problem for her as long as she can do it. Is there a way to reduce a baby size at 36 weeks pregnancy? Make I allow Dr. Israel respond. But my question, Oyet Dominic, is why do you want to reduce the size of a baby? Why? Why do you want to? You don't understand the baby needs to develop well. So why do you want to now cause harm to the baby by reducing the size of the baby? Okay, Israel, get anything to add?
Okay, and there's really no way to reduce the baby size, even when the baby is at 36 weeks. The thing is this: your baby don't big, it don't big. The only thing we go advise, because now what the mother they take, now they make the baby be who the baby be. So if the mother they eat a lot, your baby go big. If your mother they eat small, the baby may be small. And also some genetic factors still contribute to whether your baby could be big or not. But one part is that what your wife they eat, also the kind of food when they eat as well. So if you be say your wife they eat a lot of fatty food, carbohydrate, all those food, heavy food that can all those heavy food and all those junks as well. You can only tell your child, the wife, to reduce it. It's not like make it stop them, make it just reduce them. However, it not go reduce the baby weight. It not go make the baby come small, because it already big. The only thing we go do will be say, if he reduce the rate where the baby go take big from that 36 weeks to when your wife go born, finish. That's just when the lady go born. I don't know whether a woman they even talk to me. When the lady go born. So that's the only difference. It's not like you are going to now start reducing the baby's weight. The baby's weight cannot be reduced. And I don't think you have any reason to be thinking to the thing say you want reduce your baby weight. And another thing when they make baby weight they big, your wife also need to check in your sugar level. It's your wife, if the woman sugar level they normal, it's fine, it's good, it's everything is good to go. Huh? So not they worry yourself about whether you want to reduce the baby weight or normal. So far it they within the normal range.
Okay, is it true that any food you take in after 8 p.m. is poison to the body? No, it's not true. I don't know where you got that from. That any food you eat after 8 p.m., where did you get that from? I know it gets some kind people where they make some kind comments to tell you that after 8 p.m. do not eat na poison. What if the kind job where you they do we go keep you awake all through the night? Are you telling this person not to eat? So most times when people they make certain comments, they need to provide enough context because normally if you know say you know they work for night and you go sleep by 10 p.m., your dinner you're supposed to eat them early so that your body go free break them down before you go to bed. But if you they work for night, they do shift work, you need to eat maybe na 8 you fit eat or 9 p.m. because your body go need energy. So when people are making these comments, they need to expatiate or direct them to the right people where they talk them to. Do you understand? Dr. Israel, is there anything you want to add to that?
No, 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 I don't want to say anything to that at all.
Okay, okay. I did get pain for the left side of my stomach, radiating to my back, close to my rib cage. Waiting be the cause and how I feel treat them. So we won't respond.
No, you respond.
Okay. Pain for the left side of your stomach, where they enter your back and your rib cage. Now, Mr. Hillary, there are many things within that region of your abdomen and your back. Waiting they cause some, we can't confidently tell you say na this thing they cause some. If it be muscle pain, if it be pain from your colon, and they mention this word deliberately, if it be pain from the liver, if it be pain from the kidney, if it be pain from somewhere else, you understand? Now the only way to fit know exactly what they cause this pain now only when you see your doctor, they will examine you, follow you talk, then they will do one or two tests for you. Then they'll come tell you, say, okay, this and this is what you should do. But guessing like that, we know if we guess because for that part of your abdomen, the right side, not be your whole belly, not be stomach. You understand? Stomach is just one portion of your abdomen. So even at the right portion of your abdomen, where they enter the back, many things stay if it cause that kind pain for you. So the exact thing where they cause can only be diagnosed when you see your doctor and they follow you talk one on one. But online, no, we know if we give you that diagnosis because we don't know you, we never see you, we never examine you, we don't carry any tests on you. Okay, we have a question here. Is it normal to feel feverish and dizzy, even feeling like drinking only milk? The next thing tomorrow morning, it will disappear to come back in 2 months' time again. I don't
And
know. Feverish, dizzy.
okay. What I'll
Go
talk is
ahead.
it's
Go
just your
ahead.
feeling. It's just your feeling. It's what you feel like doing as at that time. So it's not like it's abnormal. As far as it does not disturb you, you are not. It's not troubling you. The main thing is that milk now you they really feel like drinking. Now that milk you they feel like drinking. So because you they feel like drinking, it just be like somebody they feel like doing something. So your body will start reacting to that thing when they feel like doing. That be that feverish and dizzy when you think say you they feel. So after that time, if you
Mm.
imagine, okay, just mistake try take the milk. You'll be surprised say as they feel like you are craving for it and you take the milk, that fever and the dizziness go your go once because it was now waiting the body your need as at that time. So there's nothing bad in it. It's just your cravings. Because many people crave for so many things, but you not depend on what you are craving at. Maybe you not go crave for waiting, waiting not go too good for the body. So I don't think there's anything bad in that. It's just your craving.
Now you're craving, no, and if your body say you want the milk, drink your milk.
At
Okay,
that
if you
time,
just
drink
dey
am.
come, you day welcome. Drink your milk. More they very fast because of time. We go soon end the live session. We have a history. We have hernia history in our lineage, but I had noticed these big testes since childhood. Please, can you tell me the signs of hernia? I think I allow Dr. Israel respond to this.
So there are different type of hernia, but the commonest one for male is the inguinal hernia, and that inguinal hernia is also divided into two. We have the direct and the indirect hernia. But the symptom, the most commonest symptom is that you go see something they protrude from the side of the hernia, like boy, eh? It they come out, but as they come out for the beginning, not they painful. You go even feel use your hand push and go back. And what they come out na the intestine, mainly the small intestine, because the small intestine are one part of the body where sabi waka go anywhere. It's mobile, very mobile. So once there's any small hole in one, it go just enter the hole. So now in the come out, now you they see that protrusion. If they soft, you can protrude through those places. You they see swelling. So that if you get cough, as you cough, that place go swell come out. It go swell come out. And you go fit, as I said, you go fit push and go inside. And you push and go inside, you'll be like, say, nothing dey there. For some people, once they lie down, the hernia go inside by itself, nothing dey there. But once they stand and they do activities, the hernia go come out again. Now, if this hernia continue and you not do anything about it, you go get one, the time go reach when we say that the intestine fit enter there. In the process of going back, you not go fit go back again. So you can't dey a bit strangulated. So once you don't dey strangulated, what go happen now? We say blood flow to that other part go reduce. That one go come dey cause pain. Now there pain go fit continue enter that protruding part of the that hernia. So you can't dey get pain. From that, there can be gangrene, there can be death of that part of the tissue, and so on and so forth. So once you don't notice say you dey get hernia, they come out, and you don't dey get pain or whatever, try go see your doctor. Now, there is no medication where you say, oh, we'll take drug, we'll take tablets, make the or injection, make that hole or that hole way open, make it come close. You know so the main treatment and surgery, they need to open and push the intestine go inside where that pocket where they there, where they open, where they make your intestine feel they come on, close am, then sew am back again. So that's the main treatment. Why in some cases they go like to one of the sort this is a weakness of the muscle. So they go need to try to put things there like merge to solidify that place so that make that weakness not happen again. Now, another thing what you need to know is that hernia fit happen more than once. So you have hernia this year, you do the surgery. If it come back again, so then if it come back for the other side, if even still come back for the former side when they for do the hernia. So I just mean you know this one. So when you say it come happen, you say, hey, this person not do the hernia, well, this and this and this, or that and that. So even after the hernia, they go still tell you what and what you should do so that make you know they stretch the muscles and your abdominal muscle too much. Make such things for not happen. Yeah, that's all.
Okay. Doctor, a lady whose neck is swollen, kind of, and was asked to do thyroid scan, and the result showed no lumps found. What is the best medication to use to avoid getting big? Mercy, make I respond. Now, when somebody gets neck swelling, no be only scan. There are many type of tests. Blood tests, um, sometimes too, they will include scan. So because say you do scan and scan said no lump, that does not mean everything is okay. The doctor where they manage the person go also need to do some more tests to find out what they go on. You understand? Because the neck swelling, get within the cause with the thyroid can be hyperthyroidism or hypothyroidism. Now only when they don't know the type of problem where they for the thyroid or can't tell you say drink medication. So because say they do scan and they no see lump inside does not mean that everything is okay because scan is not the only type of test where they do for the thyroid. Other tests they too. Hormonal tests where they go check as well. When they can't check them, together with other symptoms, because when the thyroid they enlarge, person if it gets different type of symptoms. If they sweat, if they purge, if they lose weight, if they feel tired, eye fit dey pop and many things. So when they don't confirm, they will come tell you say this is the medication, either medication to support the thyroid gland or medication to reduce the thyroid hormones, either of the two. Hmm? Yes. We have a question here. It says, I did the operation last month, December, at General Hospital. Somebody told me last month that I'm supposed to be going for checkup. How true is that? You want to respond?
Okay, you did surgery in December. Now, I don't know the kind of surgery you did. However, after every surgery, you're supposed to go for a checkup. Even when they don't remove the stitch and all that, you're supposed to go for a checkup. But now that checkup when you go for night, they go take discharge. You say, okay, oh, not come again. Oh, you are doing well. It's not like the checkup now continuously. It's not a continuous process. Say every time you go, they go for checkup, they go for checkup. No. So yes, you are supposed to go for checkup after the surgery, maybe one or two checkups before they will finally say. It depends on what they see after this surgery, and it depends on the kind of surgery when you still do. So when you go and the first time you go, they check and say, the place is clean, nothing. You go the second time, it don't wear. You go the third time, no problem. They go fit discharge you. So they don't true with you. So that's just how it is.
Yeah. Doctor, my mood do change once I'm about to see my period. I will just be getting angry anyhow. What causes that?
Now hormonal change now cause am. Yeah, that's how some people. That's what happened to some people because most of this hormone, the estrogen, progesterone, they don't increase and all that. So most persons react differently to these hormones. So I think that's your own way of reacting. So the only thing I will advise you is that even when you are getting hungry, try and control it. Just try and control everything concerning you during that period, so that may you not go talk or do things where you're not supposed to do, and may you not go cause problem for people around you and for yourself. So it's normal and there's nothing you can do about it.
Okay, let's take more questions because of time. What causes frequent urination, especially at night, and having pain at the back,
We don't answer
especially
this
the
question.
left side? We don't answer you now. We don't answer
Yeah,
you.
we don't answer the question.
Uh, okay, we don't answer you. We don't answer you. Okay, let's see if we have another question here. Somebody they asked for. Okay, now okay, Dr. Israel. The person saying
Yeah.
childbirth operation.
Okay, childbirth operation. Now, and when we talk about delivering, and when we talk about delivering, the postpartum is 6 weeks, 6 weeks after delivering. So your doctor is supposed to see you within the next 6 weeks. But you know, so that 6 weeks not missing every day or every week. You go they come hospital. So as at the 6th week, if everything being equal, that's when they will discharge both you and your picking. So within that 6 weeks, you are supposed to come with your child. They are not only seeing you, they are going to be seeing your child, your baby when you give birth, and yourself to see if there's any complication or any problem. So that one are just to find out if there's any complication, or not to just to try to uh, reduce maternal and child morbidity and mortality.
Okay, thank you very much. There's a comment here. I know Gopina say, please, I need your WhatsApp number. I don't know whether I'm me or Dr. Israel, but for me, I'm sorry, if not me, I don't know about Dr. Israel. I know they give out number on social media. I'm so sorry. We know they give out number on the internet or say chat privately or call. You understand? Uh-huh. Now only private consultation. You book for consultation, you pay for the consultation, and then we'll go make our time to follow you talk. But say we just share number on the internet. Sorry. We know they do. We have a question here. It says, whenever I sleep, wake up from bed in the morning, I always feel pain under my leg.
Okay, Dr. Fred, you can answer that one.
Okay, whenever, so two things they important here. Look be like man. Two things. Number one, which is the important now, how long has this thing been happening? Because if this thing just start to dey happen of recent, okay, maybe you get work where you do, you stress yourself, take enough fluid, drink water and rest, it will help you. But if you don't, they do you for a long time, every time you wake up they feel pain every time you wake up, then you go need more investigations, or you go need more examination from your doctor. You understand? So that maybe if you find out wetin they go on with your leg. Because when somebody sleep and wake up they feel pain under the leg for a long time, something's actually wrong somewhere. But if you just start a few days ago, rest more, take water, massage your leg, maybe not job related stress from your muscles, take enough fluid and see whether it will disappear. But if you don't dey do it for a long time, then let a doctor see you and check you. Yep. Okay, we have a question here. What kind of test can one do for a child that has lymph nodes at the back of both ears, neck, and penis area? We did a blood test, but nothing was diagnosed. Dr. Israel, I beg,
Okay, now
respond to this.
I don't know the kind of blood test you did, but I think you should go and see a pediatrician. Eh? When I mean pediatrician, Shana small picking now, yeah. You need to go and see a pediatrician. Eh? There is doctor where they specialize for children. That's the doctor you need to go and see. So they can do there is a lot of tests you can do. And ranging for from tests that we look at the immune system of your baby, of the child. And it is very important. You need to know the immune system of your child. So whether the immune system is compromised or not. So it's not just to say we did blood tests. And apart from that, you want to see if there are other things around your baby's body, rashes, how is the tongue like? Is the tongue whitish? Is there injury in the part of the body? Is the child always falling sick? Is the child purging? And so on and so forth. So if your pediatrician see the child, he will be able to tell you what kind of test you should do. I hope you know your go lab, just go do any test. I just hope you didn't do that. So, but please see a pediatrician. Is the best person to tell you the kind of medical test you will do and the best of treatment for your pikin.
Kemi says, read my question. I'm sorry, Kemi, we know they see your question. Send your question again. We get a few more minutes before we end. Shoma, good evening. Okay, drinking water at night. We have a question here. It says, drinking water at night as a pregnant woman because you feel really thirsty and dry and urinating every minute. Is this a question or a comment? Dr. Israel, can you understand this comment or?
Okay. Once you drink as a pregnant woman, normally you dey urinate always. As a pregnant woman, mostly when the pregnancy don't grow well, you dey urinate well always because the uterus, the womb, it go sit down on top the bladder. So the bladder not go fit gather many urine as it's supposed to gather before. So that's a normal thing. So and you now you can go dey add to water, drinking water at night. So it means that you don't want sleep. But yes, if you are feeling tasty, not mean say you not take water, but you just need to take a little to wet your throat, and so that you go fit sleep. And sometimes you need to take the water small for many times, so that your body fit get the water where you want, and many of them not go enter the bladder. But just know say urinating frequently for pregnant women when the belly don't come out well, na normal thing, not be problem. Except maybe as they urinate, they feel pain and some other thing before you feel on the think of something else.
Sorry, Dr. Israel, I can't hear you. I don't know what happened.
Okay, I believe other people
Hello?
hearing me, so I don't finish. Can you hear me?
Okay, cool, no problem. Yes, I can hear you. Okay, we have a question here. It says, my friend told me to stop taking family planning. If not, when I'm ready to get pregnant, I cannot. So Israel, you want to respond to this?
Well, um, I I will not tell you that it's true, but it's not really 100% true. Reason because everybody body is different. Everybody body they different. So your body fit not be like your friend body or any other person when your friend don't first see body. Some people when they take contraceptive, the moment that they remove them, that they get belle. Some people even on contraceptive that they get belle. While other people, yes, they go remove and it go take them a longer time before they go get belle. While some people they go remove and it go take them some longer time. It go even need doctor to prescribe one or two things for them before they go get belle. So it just depends on the individual. So it not mean say it's very particular about because you they take and they take and it's not really true. So it depends on the individual. I cannot tell which part you belong to. I cannot tell which part you belong to. So just be ready to face anyone you meet. So when you come ready to become pregnant, it is better that if you know say, oh, I want to get belle in the next 1 year, by 6 months to that time, you should have removed the contraceptive. You just stop her. So that within the next 6 months, your body go down, they try to they arrange to they prepare itself for the new level where you want get. And there are other medication when you go take. That's what they call the prenatal care. They take your folic acid and all that. And that one will actually prepare you. And you always get pregnant when the time comes.
Okay. We have a question here. Let me see. See whether I fit pin this question here. Okay, it says I treat infection for a long time, but I do test again. The test show clear, but I still they feel full pain for my testicle.
Still they feel what?
Still they feel pain, oh.
Okay, I think you should see a urologist. Then just say a urologist, somebody that specializes in that environment. However, as far you have done tests, you don't do test, you don't treat yourself. It means say it may not be infection again, but you should know say inflammation fit don't fair happen there, and those inflammation fit don't heal, and it depends on how those inflammation heal. And if they heal, say they can't get some adhesions, those adhesions feel they cause pain, and so um, these are some few things. It might just be saying that nothing, or it might also be saying that your mindset. Now you just dey think and say pain day. Dr. Fred, are you with me?
Yes, yes, yes.
Okay. If you just be saying that your mind they think and say pain day. So however, you need to see a urologist, somebody that specializes in that area, part of the body, and he go tell you, if he tell you may you do one or two tests, if he even do if he do scan for you and anything, then you go know if there's any problem or not.
My wife always have running nose after waking up in the morning for some months now.
Okay, your wife, they get running nose. If you wake up in the morning, they sleep under bed, under fan, or is the place dusty? So it can just be that your wife is allergic to something. Either the bedspread, if they sleep under AC, they sleep under fan, is the place very hot, and so on and so forth. So it can just be that your wife is allergic to something. So it is for you to find out what is my wife allergic to, so that we can remove that thing, so that kata, those early morning kata or running nose can stop.
Yes. Okay. As a diabetic patient, is it advisable to eat swallow unripe plantain in the morning?
Okay, and now one thing we need to know is that recently nowadays we not dey really pay more emphasis on the food when you eat. And when I say we not, it's not like we not dey take consideration of it, but we not dey really say you must eat this, not eat this one again, not eat this one again. No. So all what we say is that do everything you do in a moderate form. So if you know you want to eat swallow or ripe plantain in the morning and you not get problem with it. So far you dey take your medication very well, and those food where you want eat, you eat it in a normal um portion. Not be the one when be say you want eat the whole world. You take the normal portion. There's no problem. Eh? You can eat your food. So far you are taking your drug very well.
Okay, thank you very much. We have how many more minutes? We have a few more minutes and then we are done. Doc, a medical professional claimed that boiled carrots gives you more carotene. Is it true?
Dr. Fred, you can answer that.
My dear, I don't know about this one. No, how I know that carrots get benefits, but boiling it, I don't know. So I know will comment. Destiny, I know will comment. Waiting, I know they sure of. You understand? Yes, if you boil them, it will make the nutrients they absorbable. However, it will reduce some of the antioxidants with the inside carrots. But what you go do be say it go help you make them more absorbable. But all the whole carotene stuff when you boil them, I don't have that information in my head. Sorry. Okay. Pablo, okay, you're welcome. Manadu, good evening. Well done. How you day? Okay. So let's see whether I get any question where we miss. I hope we don't miss any question here. I did try go back and check and the check and the check from the beginning. Let's see. Okay, there is no question, Abby. We don't answer. Dr. Israel, any words as we round up tonight?
Okay. The only thing I will say is that for those of us in Nigeria, we notice that the weather is very hot this period. So try and take a lot of water. And if you notice that you're weak, you're tired, just relax and try rest. The rest well this period and take a lot of water. And I will not fail by saying that, and we will try to take care of our mental health. And the situation in the country, the situation in the world is not smiling. In the world, no one is smiling. So we will take care of our mental health. It is very, very important. Thank you, and God bless you all.
Yeah, thank you so much, Dr. Israel. Take care of your mental health. In addition to that, I beg for those people where they live for developing nation for this part of the world, healthcare they very expensive. You know one fall sick. So I beg, protect your health. Try the rest. A lot of people they work so hard and this stress too they affect them. A lot of people don't know they check their blood pressure and if it affects your kidneys as well. So I beg, monitor your blood pressure, try take out time to rest, take your water. Yes. Um somebody says I would okay, let me take this comment quickly. He says, Doctor, I don't have an account and I would love to join your membership. How is it possible? Okay, for anybody who want to join my own private membership, now subscription, you go subscribe. And when you say you don't have an account, I don't understand. There's a link on the page. Anybody who wants to subscribe, it's not for everybody. Now, few people now subscribe and they there. Look for the link. The link is on the page. You go see them. Check on at the top of this video live session. You go see them. Subscribe. Click on them. You go ask for some details. You go put the details and make sure you download Telegram. It's not for everybody. Only subscription. So when you subscribe and join, we'll take you there and we'll add you into the platform. There you can ask questions. I will respond to you almost immediately. Respond to you almost immediately. As much as you will answer you. So please try to look for the link and the details. They're easy to subscribe and join. Thank you everybody for joining. Thank you for watching. Thank you for spending your data on this live session. We not take your presence here for granted. I always tell you, good life now waiting. Good life.
Nonsense.
Nothing. Yeah. Take care and have a wonderful day. Bye bye. Bye bye.
Bye bye.